In today's session, we're going to talk about a lot of different scenarios in breast cancer. And in my lecture in particular, I'm going to talk about thermal ablation, and especially about cryoablation, which is the most suitable and versatile technique for breast treatment. It can be a good treatment option for patients unsuitable for surgery because of age or comorbidities, and it can also have a very important role in low-risk breast cancer. We're going to dive into the current evidence that we have, and we will share our own cases and our excellent results.
I will talk about open debates in ECC management. In particular, in my lecture, I will talk about BCLC staging and if we have to move on from BCLC staging. I will talk about two important publications we have in the last years. We propose a new scheme alternative to BCLC staging and more adapt to the modern management of ECC, the multidisciplinary and tumor board.
This afternoon, we have a very exciting session about targeting tumors with different treatments. My topic will be how to ablate larger tumors. I'm going to talk about intraarterial delivery of ablative doses with yttrium-90 microspheres, otherwise known as radiation segmentectomy. I will present new concepts about the use of this modality, especially for metastatic disease, and I will show you what are the thresholds of dosimetry that not only provide for the best local tumor control, but actually have an impact, a positive impact on patient survival.
In today's video learning session, I will highlight our workflow in Amsterdam for our liver ablation procedures. So we perform those ablation procedures with CT hepatic arteriography, so that we can give small amounts of contrast directly into the liver in order to better visualize the tumor. It has many other advantages, and I'm happy to show you that today by means of some cases.
In today's session, as at ECIO, I will show you the inclusion criteria for liver transplantation and how can interventional radiology downstage a patient, including the more patient as possible into these enormous opportunities. I will highlight moreover the all-comers HCC that are patients that are definitely outside liver transplantation criteria, while interventional radiology can bring them inside liver transplantation criteria, and so to obtain an enormous gain of survival for these patients.
Well, ECIO is a great event. I mean, this is a great location to meet with a healthcare professional, to better understand, let's say, the dynamics, the driver, but also the latest innovation in terms of tools, in terms of studies, but also in terms of clinical gaps. So we at Canon Medical, we believe that by having this constant dialogue with professionals, help us to provide solutions that are meaningful to the community.
We have a lot that we show during at our booth around holmium, SERT therapy, around DEMPACE, and the newly launched platform, which is bioresorbable DEMPACE platform, BioPearl, and we can see a lot about it during our symposium. We also have access and target lesion access products that allow to bring radial to visceral interventions. And one thing that's also very interesting to look at is our new simulator for tattoo ablation for thyroid, which is an extended reality simulator that allows physicians to truly simulate an ablation as if they were there. So it's always amazing to be at ECIO because on the one hand we learn a lot, but also we bring a lot, and it's an amazing mutual relationship.